When 100 Indian doctors were refused visas for work in the UK last month, it sparked a row about what sort of impact the tightening of immigration rules was having on the NHS.
Health leaders said patients were being put at risk as positions were left unfilled. Well, now the British Medical Journal has launched a petition calling for restrictions to be lifted. Andrew Foster is the Chief Executive of the Wrightington, Wigan and Leigh NHS Foundation Trust and joins us now. Very good morning to you. Tell us why you are petitioning.
Well, my organisation coordinates one of the biggest overseas ethical recruitment schemes for doctors. It's been running for 12 years and last year we brought in 60 doctors largely from India but from 20 other countries as well. The plan this year was to increase the scheme even more because of the massive shortage of doctors we have in this country, and we're planning to bring in at least 120 doctors this year. We went out last year, interviewed, had loads of people willing to come here, and 100 of the first visa applications were rejected in March, 100 were rejected in April, and almost all of them were again rejected in May.
Why? Because of stricter visa rules?
Because of reaching the visa cap. So in each of the previous years, and as I say, this has been going for 12 years, we've had no problems at all. But this year, I believe that other industries are also trying to bring in people from overseas to skilled jobs, and so there is a limit on the monthly numbers, and it's begun to hit the NHS. But my argument is that this is balmy. You know, you've got one branch of government which is trying to fill the desperate gaps that we've got in the health service, and another branch of government that's stopping you.
But doesn't that mean that more people will be trained here in the UK?
The scheme that we run is called Earn, Learn and Return. So people come over here for 2 to 3 years, they do a master's degree in their own time, we employ them full-time, and at the end of that they return to their country. So it's not replacing people here. There is an increase in medical students, but it's not going to produce new numbers here for 10 years.
So Andrew, just to take that one down the line a little bit. So if you can't bring in the numbers you want to, and you know there are gaps, there are jobs that need doing today, tomorrow, 6 months' time. What does happen? Who will people see when they go and try to see a doctor?
I mean, when we have a shortage of capacity, then at best people simply wait longer, but at worst it can become an issue of patient safety. If we can't 24/7 have enough doctors to look after people who are seriously ill, it is a threat to patient safety.
So are we at that stage now? You're obviously looking ahead, you're trying to bring people in all the time. Is this a creeping problem that gradually is going to be manifest in the care people are receiving?
I think you've just had an item showing how the NHS has had its most difficult winter ever. And this is with 10,000 doctor vacancies, 40,000 nurse vacancies. This is a workforce crisis, and we're trying to solve it. We've actually got a solution, and who's stopping it but a branch of our own government?
Can I just put to you what the Home Office is saying? Because they say the system as it stands is in the national interest and it makes sure that employers, I know I've mentioned it, look to the UK first before recruiting from overseas, and also the people whose visa applications are rejected can apply again, and that also there are specialities including A&E and radiology that are on the shortage occupation list and they haven't been refused visas.
And that is correct, that a small number are getting through. But we've actually got desperate needs in many other specialties as well. It's not just A&E and radiology. It's acute medicine, it's gastroenterology, psychiatry, paediatrics, and everything where we've got these shortages. So I think that, you know, when they say it's in the national interest, is it really in the national interest to have an under-doctored service? I understand that they are trying to control immigration, but I think if you were to ask the public, you know, which would you rather have, a properly doctored service or meeting some arbitrary number of caps of visas, I'm pretty sure what most people would say.
Andrew Foster, thank you very much for your time this morning. Andrew Foster, Chief Executive of the Wrightington, Wigan and Leigh NHS Foundation Trust, talking about recruitment of doctors from overseas.